Last fall, Lindsay Turman's second pregnancy suddenly got very complicated. That's when the Augusta woman learned her aortic valve had severely narrowed, and without a new valve, doctors weren't sure she'd survive her baby's delivery. The Fox Medical team's Beth Galvin is here in studio with us with her story. This just made my heart sink just seeing some of these images of her in the hospital.
Yeah, this is just a really powerful story. Lindsay had already been through one open heart surgery to replace that valve back in 2017. And a year later, she got pregnant and had a very smooth delivery. But now she was pregnant again. And this time it would take a medical village to get Lindsay and her baby safely through this delivery.
When Lindsay Turman's daughter, Adaya, was born January 27th, the 31-year-old felt like she could finally catch her breath.
I cried, and I'm so thankful that the Lord had brought all of us through.
Because months earlier, Lindsay and her husband, Tevin, had come here to the Piedmont Heart Institute from Augusta after learning the aortic valve surgeons had replaced in 2017, which had held through her first pregnancy with their daughter, Eliana, was now narrowed and failing.
And that aortic valve posed a risk not only to her life, but also to baby's life.
Very scared. I was sad.
You could see her struggling.
Turman's heart surgeon had sent her to see Piedmont cardiothoracic surgeon Dr. Vinod Thurani.
The question of how to deal with this is unbelievably complicated.
And interventional cardiologist Dr. Pradeep Yadav.
Both the lives were in jeopardy if you don't fix the valve before delivering.
So they pulled together a room of specialists to try to figure out what to do.
From the OB team, the first question was, why don't we just do a C-section and just take the baby out and then you can deal with the valve? The problem with that scenario is the moment you give anesthesia, there was a 50-50 chance that our heart rate would slow down or our blood pressure would drop.
That could be deadly. Another option was to deliver the baby prematurely, but they weren't sure that Turman's aortic valve would hold. So they chose to go with a transcatheter aortic valve replacement, or a TAVR procedure.
The plan was to get me to 32 weeks. That way, in case something happened, the baby could come out and she'd be preterm and go into, NICU, but she still had a pretty good chance of survival.
But the planning required incredible teamwork.
Making the decision of which way to do it and getting OBGYNs, cardiologists, imagers, interventional cardiologists, cardiac surgeons sitting in one room together and making that decision of what to do.
We drew several scenarios, like what if this were to happen? How are we going to act in what sequence? Because if an emergency were to happen, there was no time to think about it.
Lindsay Turman made it to 35 weeks in the OR with Thurani and Yadav working together. They were surrounded by about 15 to 20 specialists.
So they had the OB, the heart surgeon, the anesthesiologist, the TAVR surgeon, and then they all had their team to help them.
Turman never had to go under general anesthesia. And the team, careful to shield the baby from radiation, threaded a catheter or a long, thin tube up from her groin to her heart.
And through that tube, we can advance a brand new valve all the way to the heart. And once we're in position, we can pop that valve open. The valve starts working right away.
The procedure went off without a hitch. 3 weeks later, at Piedmont Hospital, Adaya was delivered by cesarean section.
I remember just hearing her cry immediately, and then, they bring her to me and just being so thankful, like, you're here, like, and she's such a fighter. So I was just really thankful to hold her and be like, you did it, little girl.
And Lindsay's heart team at Piedmont wanted her to deliver there so that they could be on standby in case there were any complications during the delivery, just like the OB team had been on standby in the operating room for complications during her heart procedure. And Dr. Thurani says when they got the news that her baby had been safely delivered, he says they all got on a Zoom call and had a champagne toast. Christine, you talk about like so many different specialties all having a stake and, getting this young mother through
and
this.
It was such a wrenching decision for them. They specialize in this. And it was still complicated to figure out how to do this.
Yeah.
So glad there's a happy ending.
Yes.
And her baby's so cute. Her whole family. Thank you, Beth.